Ovarian torsion is one of those pathologies that straddles both general surgery and gynecologic surgery providers. But in pediatric surgery, often ovarian torsion really falls into our wheelhouse. And so today we're going to review up-to-date best practices with an expert.
And as general surgeons, we do not do a good job in ovarian preservation, so it's something that we really need to think about. Our gynecology colleagues do a much better job, and we're seeing a change in that our practice, but it's still not good in terms of how many ovaries that general surgery takes out compared to gynecology.
That's Dr. Roshni Dasgupta, a pediatric surgeon at Cincinnati Children's Hospital Medical Center, and today she's going to teach us all about the workup and the management of ovarian pathology in the pediatric patient. So stick around. This is the StayCurrent podcast. In a patient with ovarian torsion, well, there's a lot to consider. First, we have to figure out the diagnosis, and that's not always clear. Then second, once you make it to the operating room, there's a lot of variation about what you should do.
Surgeons in general that we, again, don't do a good job in terms of keeping ovaries. The rate of oophorectomies was pretty significant on patients that had ovarian torsion. About 15% of them only underwent detorsion in the A series that looked at 2,041 patients from 2000 to 2014, and many of them, vast majority, 80% almost, had an oophorectomy.
If you're listening in the StayCurrent app, we've got the full article linked below, so check it out.
Oophorectomy were higher in non-teaching hospitals, younger patients, and in the South, and some of the rural disparities that we were talking about. But even recent data as of last year showed that still 1/4 of patients who have ovarian torsion are still getting oophorectomies, despite all this evidence that you shouldn't do it. And again, it's pediatric surgeons versus gynecologists that are doing all these oophorectomies.
So in a patient with ovarian torsion, what should we be doing intraoperatively?
So I'd untwist it and take a look and see if it would pink up.
Now, that's all well and good for an ovary that pinks up and starts looking viable in the operating room. But what about the ovary that looks black after you've waited 5 minutes? And then even after you've waited 10 minutes or even longer?
Do you want to leave that alone? So even if they pinks up, great. But even if it's black, like that picture right there, you should leave it alone.
I trust you, Dr. Dasgupta, but it just doesn't feel good to leave non-viable looking tissue inside a patient. So what makes this an acceptable approach?
Ovaries have dual blood supply. They do pink up, and almost all of them are salvageable. So you definitely do not want to take them out. There's really if you are worried that there is a mass there, you want to do that 3-week ultrasound and see if there is a mass there, and then you can go back in. But you really do not want to mess around with a torsed ovary. You just want to untwist it, leave it alone, and come back another day.
Well, I can definitely see how general surgeons may take out more ovaries than needed.
Sometimes ovaries that look like this just pink up and look normal and actually have excellent function. You know that by taking out an ovary, you increase this menopause by 7 years. So you have menopause 7 years earlier, and you can affect fertility rates. So it's really important to try and preserve the ovaries if you can.
Is there anything else I should be doing in the operating room? I mean, besides detorsion, can ovarian Pexy help decrease my chances of future torsion?
There's been a Cochrane review that has really showed that actually ovarian Pexy can actually cause more problems, and that it's probably not indicated unless you see a really, really sort of spread out broad ligament or some other reason for it to be for it to torse.
All right. So just to review, a patient with ovarian torsion, well, they need an operation. So they go to the operating room and the ovary gets detorsed. If the child's not sick, then the ovary can be left in place, really regardless of the appearance. We make sure to inspect the ovary and note any concerning findings regarding a mass or anything else that we'd want to follow. And a Pexy, well, it's just not indicated for the majority of patients, but a follow-up ultrasound is, especially if there's concern for a mass. Overall, fertility preservation is a key component to proper management. Did I get all that right, Dr. Dasgupta?
The gynecologists are much more likely to perform ovarian preservations than pediatric general surgeons. And, we just need to be very cognizant of ovarian preservation and thinking about it at all points, and even in neoplastic tumors, ovarian torsion, and things like that, where you might be able to save the ovary.
Thanks for joining our StayCurrent short on ovarian torsion with Dr. Dasgupta. Remember, download the StayCurrent app, check us out on YouTube and Facebook and Twitter, but until next time, I'm Brittany, and remember, knowledge should be free.